we are looking at ovulation dysfunction. For this, we saw Kallmann syndrome, PCOS, and now we are going toward premature ovarian failure. Premature ovarian failure is also called as primary ovarian insufficiency, and it is the early aging of the ovaries that shows the sign and symptoms of menopause and an ovulation, that is an ovulatory dysfunction. In case of normal women in Indian subcontinent, the women of 45 year or above, they show the sign and symptoms of menopause, that is amenorrhea, the lack of menses, and the anovulation. We know the ovaries, they have finite number of ova, so they would be depleted. We know one or two Graafian follicle, they are uh, ovulated at every cycle, but the rest of the follicles, they would go to regression. So the pool of the ova in ovaries depleted with age, and the normal age in case of Indian women, we said it is 45 years, and for the other population like European and American, it is 51 years. So before this, if the pool is depleted, it means it is primary or premature ovarian failure, or it is primary ovarian insufficiency. And it is characterized by, when we diagnose, we see if age is 50 year, then we would say it is menopause, it is normal. But if age is less than 40 year, then we say it is primary ovarian insufficiency or premature ovarian failure. So it is the age that is less than 40 year, and then the amenorrhea would be there, that is the absence of menses, and then there would be hypergonadotropic hypogonadism. As we know, the estrogen is produced from follicles, and it gives negative feedback to the gonadotropes, FSH and LH. And if estrogen is not there, FSH levels would increase, that is called as hypergonadotropic, mean increase in gonadotropic hormone. So gonadotropic FSH would be increased, that is called as hypergonadotropic hypogonadism. And hypogonadism mean the insufficiency of the reproductive hormone, and then reproductive functions. Then another characteristic would be the presence of infertility. So if these things, amenorrhea and hypergonadotropic hypogonadism and infertility, they occur before 40 years of age of women, then we say they are going to premature ovarian failure. The prevalence of POF is 1%, and most of the time the causes are unknown. They remain idiopathic type of POF. In these idiopathic type of POF, the genetic mutations were searched, but very few were found, and the in the case follicle stimulating hormone receptor FSHR antibodies were also found. But the antibodies against ovaries, they are not correlated with the inflammation of ovaries or the POF. So we cannot make diagnosis on the basis of presence or absence of anti-ovarian antibodies in blood. Still the causes are unknown for 60% of the cases, and in other 40%, the genetic mutations were found, autoimmune diseases were found, vaccination were also factor, enzymatic and cancer therapies or environmental causes are there. uh, the genetic mutations like Turner syndrome was found. Turner syndrome is the monosomy of X chromosome, that is the one X chromosome in women is missing, or part of the X chromosome is missing. So this Turner syndrome was found linked with the uh, that is POF. Fragile X syndrome, that is the uh, intellectual disability syndrome, that is the person having the gene, that is FMR1 gene, Fragile X, uh, 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 mental retardation 1 gene mutated on the X chromosome would be intellectually disabled, having low IQ. So these FMR1 gene, they when their CGG repeats, that is the cytosine guanine repeats, they would be expanded in FMR1 gene. Their number is increased, then there would be methylation of this gene, and then the this gene could not be transcribed effectively, and the protein that this gene makes would reduce, and so that would be the cause of intellectual disability. So this syndrome was found linked with the POF. And if a woman is intellectually disabled, would also have POF, that is premature ovarian failure. Similarly, pseudo hypothyroidism type 1A was also found linked with the uh, POF. Pseudo hypoparathyroidism is, we know the parathyroid gland is releasing a hormone, that is parathyroid hormone, that is adjusting calcium into the bones, and it is then uh, decreasing levels of calcium in blood. But in case of hypoparathyroidism, the calcium level, they would increase in the blood, because the parathyroid hormone would be low. So the vaccination against human papilloma virus that may cause the sexually transmitted diseases, um, and the vaccines are to prevent these sexually transmitted diseases, and they were found to be associated with the premature ovarian failure, or the adjuvant used in vaccine may affect the ovaries, and they may develop the premature ovarian failure. And there could be enzymatic issue, deficiency of enzymes, like enzymes for glucose metabolism. They were also found to be associated with the mature ovarian failure, but it is only few reports. And then the cancer therapies, they may affect on the uh, ovaries, and they may uh, result in the premature ovarian failure. The radiotherapy, they may damage the ovaries irreversibly and permanently, and the medicines, the oncological uh, medicine that are for treatment of the uh, tumors and cancers, they may affect the hypothalamo pituitary gonadal axis or ovaries directly. And there could be environmental issues such as the infections of the mumps virus, cytomegalovirus, and varicella zoster virus, and there could be tuberculosis, malaria, and Shigella infections. They may affect the ovaries directly, or there could be the exposure to certain chemicals, like smoking is the uh, main cause of the premature menopause or premature ovarian failure. So this there could be exposure to certain other the endocrine disruptors present in environment, in the automobile industry, in paints, and the could be drugs that would affect it, but still the most of the causes they are unknown for POF. The symptoms of POF are like the symptoms of normal menopause. That are the most obvious symptoms include hot flushes. Hot flushes could be described as sudden feeling of warmth in the upper body that is mostly intense over the face, neck, and chest, and it remains for a few minutes. And there could be a lot of hot flushes per day. So then there could be excessive sweating, nervousness, low libido, and these are the symptoms of low estrogen levels in body, and weakness, and due to low level of estrogen, skin dryness, and the dryness of the mucous membrane where there is it is present in respiratory system, in the reproductive system, and could be osteoporosis, that is the decrease in estrogen would increase the bone poration, bones would become fragile. There could be vitamin D deficiency, and it should be measured. So then metabolic disorders, there could be metabolic disorders that are the resulting in hypercholesterolemia, that would result in cardiovascular diseases, and hypercholesterolemia, atherosclerosis. So they are related with the POF. And then the most obvious is infertility, and then there could be few other symptoms that are the autoimmune hypothyroidism if the disease is due to POF is due to autoimmunity, and it could be due to, there could be another symptom of adrenal disease, there could be diabetes type 1, and so these are symptoms of the POF. The diagnosis of POF is done by the presence of oligomenorrhea in women of less than 40 years for 4 months. Oligomenorrhea we know is the uh, gaps between menses, and they are not regular, they are less than the 12 menses per year. So in there could be amenorrhea, that is the total absence of menstrual bleeding or cycle, and in women of less than 40 year of age. So the first criteria is that is the absence of menses, or it is less frequency of menses than normal, and they should be for more than for 4 months. Then the second method is to step is to diagnose the ovarian reserve, that is the how many follicles are primordial follicles are already present in the ovaries or remaining in the ovaries. So it is done on the third day of cycle normally. So in this case, if ovarian follicles are less, then FSH level would increase because estrogen is not being produced sufficiently and it is not giving negative feedback. So if FSH levels are greater than 25 international unit per liter, then it is diagnosed as POF in women of less than 40 years. So it means their ovarian reserves are less, and their follicles are reduced, they are depleted. We know a lot of primordial follicles they are recruited, and then only one of them is two of them are few of them are then released from the ovary. So the rest would undergo to arrest. So FSH levels If they are greater than 25 international unit per liter, then it is POF. But the research says that if FSH level are just greater than 10 international unit per liter, those women have less chances of pregnancies, because the uh, the FSH level, they are showing that estrogen are less, so there could be premature ovarian failure in those females that are having FSH level greater than 10 international unit per liter. So the other criteria, that is the best method to determine the ovarian reserves, how many follicles are there in ovaries, is through determining anti-Mullerian hormone. Anti-Mullerian hormone is released from the granulosa cells, and if primordial follicles are there, anti-Mullerian hormone is released in larger quantities. If the primordial follicles, they are not present, or they are less in number, the anti-Mullerian hormone concentration would decrease in blood. So the anti-Mullerian hormone, it is decreasing with age. It is released more at the onset of puberty, because ovarian reserve would be a lot. So these primordial follicles, when they would be recruited, their granulosa cell would be releasing anti-Mullerian hormone. And later on, when we know at every cycle they are depleting, so the ovarian follicles are depleting, and few of them are ovulating. So these less reserves of ovarian follicles would release less anti-Mullerian hormone. So anti-Mullerian hormone actually become negligible 5 years before the onset of normal menopause. So it shows the concentration would tell us about either the POF is there or no. Anti-Mullerian hormone would be lower in POF. And inhibin, we know inhibin is released from the follicles under the influence of FSH. So they would give negative feedback to FSH. If there are no or less ovarian follicles, then inhibin is not released in sufficient quantities, and it would be decreased in the blood and the ovarian stroma. Estradiol, it is released, estrogen is released from the ovarian follicles. So if follicles are not there, estradiol levels would decrease than the normal. So these are the criteria. The first thing that the apparent, or that is from the personal questioning, is oligomenorrhea and amenorrhea from the women that are suspected for premenopause or pre-ovarian failure or premature ovarian failure. And the women, if they are less than 40 years, then obviously they would be going under the screening for FSH, anti-Mullerian hormone, inhibin, and estradiol. So the best is anti-Mullerian hormone determination. Treatment options for POF are very few. As we know, a lot of cases of POF are um, idiopathic type. Their causes are not known, so we cannot recommend any medicine. But in few cases, when the cause is known, cause-based medicines are being used. So there, if it is in known causes, the autoimmunity is the most abundant. So uh, anti-inflammatory medicines are being used to reduce inflammation. That is, the high concentration of corticosteroids are given, and antibodies are also used. Anti-antibodies uh, are those antibodies that would manage antibodies produced against the ovaries. And there are uh, reports that melatonin is also responsible for the cure of the POF due to anti-inflammatory activity of the melatonin. And the inhibition of the reactive oxygen species. Reactive oxygen species are also responsible for the POF. So then there are reports that transplantation may be helpful for the germinal layer of the of the ovaries in order to restore its function. So there are reports that oogenesis started in ovaries where the tissues are transplanted, but those ova they were not mature and they were not released from the ovaries. So the treatment options are very few.